everybody, and welcome back to my channel, Contouring Cancer. This week I said that we'd talk about CT scans because I had to go and have one last week, so that's what I plan to do. So what is a CT scan? A CT scan is a computerized axial tomography which uses X-ray and a computer to produce cross-sectional images of the body. You do not understand how difficult that was to say. That's about take 53. Anyway, CT scans have actually been used since 1974. And if you're wondering why I'm looking down here, because I've got it all written down, propped up under my camera. It can now show small nodules or tumours which can't be seen on an X-ray. It takes pictures of cross-sections or slices of the body this way. So it's like, it's non-invasive, it's it's safe, and it's usually well tolerated. It's most commonly used to evaluate the brain, neck, spine, chest, abdomen, pelvis and sinuses, or in my case, veins. It's different to an MRI. An MRI uses a magnetic field and radio waves to produce the images, where the CT scan uses X-rays and computer. And a CT scan are very good at evaluating soft tissues as opposed to an X-ray, which is much better at producing the pictures of the bones. So it's used to look for the spread of cancer. It can be used for many other different things, which I'm sure I've got listed down here somewhere. We'll go into in a second. It's very low risk, although you are exposed to a very small amount of radiation. So if there's any chance you could be pregnant, or I think the other thing that they asked was about any kidney problems, you have to tell them. They ask all that anyway, but it's very, very minor, very small amounts of radiation. Sometimes, most times, it's called a contrast CT, and that's where a dye is injected into the vein, and that helps to distinguish between the normal and the abnormal tissues. It also helps to distinguish blood vessels from things such as lymph nodes. There is a small risk of an allergic reaction to the dye, and there's also, this is where the kidney comes in, I think. The dye can damage the kidney, especially if there's already some sort of kidney problems already present. So the procedure, what happens? Sometimes you're told to drink lots of water before you go for your CT scan. Other times you're told not to eat or drink at all. In my case, I've always been told to drink plenty of water, which I do anyway, because I don't know if I've said before, but it does help to sort of plump up the veins, especially if you've got a problem such as I have, where your veins are sort of almost non-existent. A lot of water prior to any blood test or IV or whatever, it does help to sort of plump them up a little bit, the excess water in your system. So I normally drink at least 2 litres of water before I go for my CT. The CT scanner is a table with a donut shape at the end of it, and you normally go either head or feet first through the donut. There's not usually any problem with claustrophobia or anything, because it's all open. You sort of, the donut is maximum this deep, maybe this deep, but you know, you just go through it. It's an open tunnel, so at no point do you really feel claustrophobic. And I have got a photo of the scanner here. Right, what happens when you get there? So you'll be taken to a room and given, if it's the head, I don't think you have to bother. If it's the any part of the chest or abdomen or pelvis, then they will ask you to put a gown on, because you shouldn't have any metallic anywhere. So earrings, necklace, rings, things like that, you need to remove and put a gown on. I think if it's something being done to your legs, then again you don't need to bother with the gown. They'll ask you all the questions when you're in this room, and then they'll take you and someone will put a cannula in, if that's what you're having, if you're having a contrast CT. What have I got here? Yes, on some CT scans, especially if it's the abdomen, instead of the contrast dye being put into your veins, they will ask you to drink an oral contrast which contains dilute barium, and that just shows up better with the gastrointestinal tract, the small and large bowel. So either way, there will usually be a contrast dye or a contrast drink that contains barium. Once you've had the cannula in, you'll be called through to the scanner room, and normally you will lie on your back on a table, and then that moves through the donut, either head or feet first. I've usually gone head first, but this time when I went to the other hospital, it was actually feet first, and I don't know if that's just personal preference of who's doing the scanning or what, but anyway, I went feet first this time, but I normally go head first. You have to, when you're actually going through the scanner, you have to keep very still, and you could be asked to hold your breath for up to 20 seconds. This is just to sort of stop any blurring, apparently. Head scans, yeah, if you're having a head scan, you can wear your street clothes. You don't need to bother about anything else. It's just to take off any jewellery, really, glasses, earrings, things like that. While you're having your CT scan, the technician is usually in the next room and can see you through a large window. There is a microphone so that you can sort of you can speak to them and they can speak to you. And what happened with me, I had, because I was a venogram, apparently the only difference really is that it's just a different length of time between having the dye injected and having the scan done. And when you have the dye injected, I will tell you, it's a very strange feeling. You sort of get quite warm all over, and you sort of feel like you've wet yourself, basically. It gets very warm down there, but that goes off within a few seconds, and I always get a very strange taste in my mouth, very metallic taste. Apparently some do, some don't, but it was the same dye for me with the venogram as it was when I've had normal CT scans, which have been to look at the liver or the lungs or whatever. So it's the same dye. It was just that I had to wait a few minutes more. Normally, if I go in for a normal abdomen torso scan, I will go head first. I will put my arms above my head, and they will attach the dye, the pump, and then just before I go through the scanner, they will pump the dye in, and it's almost like, right, okay, the dye's going in, that goes in, and then the scanner kicks in. Where this time, it was pumped in, and it was quite a few minutes. I would say at least five minutes maybe before they even started the scan. And apparently that's because it was the veins and not the normal scan. So but you're sort of, you're lying on your back, it starts to go through, you have a like a recorded voice which will say breathe in and hold your breath and then breathe normally. That normally happens 2 or 3 times. The scanner's going backwards and forwards, and that's it. Like I say, you're not claustrophobic because everything's sort of wide open around you. You're only sort of inside the scanner for a few minutes, and I would imagine a head scan would be possibly a little bit longer, but you're not closed in. At no point do you actually feel sort of claustrophobically closed in, because it's not close to you. It's not sort of here, it's like here. So it's not too bad. I don't suffer from claustrophobia, so I can't say for definite that you wouldn't feel that way, but I don't feel that it's too close or that it's sort of in my space. But like I say, everybody's different. Yep, once that's done, they'll come and they'll take out the cannula, and I was told I had to sit for 20 minutes. I'm not sure why, but they came back after about 20 minutes and asked me, you know, do you feel okay and everything okay? And I'm like, yeah, I'm fine, so I could go home. After that, the scan is then studied by a radiologist, who is a medical doctor that has been specially trained to interpret the X-ray slides. They then send a report to whichever doctor, consultant, whatever, who ordered the original scan. There are no real side effects to a CT scan, unless you have an allergic reaction to the dye, and that usually occurs immediately or within a few minutes of having the dye injected. So that can be dealt with at the hospital. It's not normal, or it's unusual to have a reaction to the dye sort of later on that day, the next day, whatever. If you do have an allergic reaction to the dye, the symptoms will include itching, difficulty to breathe, difficulty swallowing. The other thing that can happen is that the dye can leak at the IV point, at the point where the cannula is. It can leak into the skin, and if that happens, then you know you need to keep your eye on it in case it gets red or it starts to swell or you get any pain in it. My procedure, mine was called a venogram, which was a contrast CT which shows how the blood flows through the veins. The venogram is usually used to look for blood clots, to identify a vein for use in bypass surgery or dialysis access, or to assess varicose veins before surgery. In my case, it could help in placing the portacath, and it makes sure that there are no blood clots anywhere that we don't know about, because apparently, even though I am on twice daily injections to keep my blood thin, which is delta-parin, I think, I still can produce clots. So it did say that the scan can take 30 to 90 minutes. It didn't seem to take anything like that. It was probably start to finish 15-20 minutes, about that. But then of course I had to wait 20 minutes afterwards before they would let me go. But it certainly didn't take 90 minutes. So that's all I can tell you really about a CT scan. Apart from getting the IV in, they don't hurt. I have got some pictures of what the CT slides look like. So if you've got any questions, leave a comment down below. If you've enjoyed this video, then think about subscribing maybe, or leave me a like. If you didn't like it, leave me a dislike. Tell me why you didn't like it. I have a few ideas for the next few videos. So yeah, I think that's about it. How long have we taken? Oh, right, this is, it's saying 18 minutes, but I've fluffed my lines a few times, so we'll probably get that down to about 10. So thank you for watching, and I'll see you soon. Bye.